Welcome to Keep the Faith Ministry News. As cases of COVID-19 rise throughout the U.S., health officials warn that an increasing number of fully vaccinated people are being hospitalized or going to the emergency room. Quote, "What we're starting to see now is an uptick in hospitalizations among people who've been vaccinated but not boosted," Dr. Anthony Fauci, the director of the National Institute for Allergy and Infectious Disease. The concern about waning immunity against severe COVID infection comes as the Food and Drug Administration is expected to authorize a Pfizer-BioNTech vaccine booster shot for all adults 18 and older. Dr. Rochelle Walensky, the director for the Centers for Disease Control and Prevention, reported a decline in vaccine effectiveness among adults 65 and older and residents of long-term care facilities. Walensky also pointed to new data on long-term care facilities from the agency's Healthcare Safety Network, comparing rates of COVID disease between people who are vaccinated with 2 doses and those who have received extra doses. Quote, "The rate of disease is markedly lower for those who received their booster shot, demonstrating our boosters are working," she said. Fauci and Walensky stressed that the majority of hospitalizations and deaths are still among unvaccinated people in the U.S. The current 7-day rate of hospital admissions is about 5,300 per day, according to the CDC, and about 1,000 people in the U.S. are dying from COVID every day. Still, it's not clear how many breakthrough hospitalizations there are from the 31 million people who have received extra doses of a Pfizer, Moderna, or Johnson & Johnson vaccine. The CDC website shows data only through August 28th. According to the latest data from the CDC, an unvaccinated person is at 11 times greater risk of dying from COVID than a vaccinated person. The CDC didn't respond to a request for new numbers. Should younger adults get booster doses? Fauci pointed to data from Israel that show a major improvement in protection against severe disease and hospitalizations in those who have had boosters compared to those who haven't. In a study published last month, Israeli researchers found a 20-fold reduction in severe disease among those over 60 who got booster shots. Another study last month from Israeli researchers and faculty members of Harvard Medical School found that booster doses were 92% effective at preventing severe disease when compared to having received a standard 2-dose regimen at least 5 months previously. As vaccination rates increase in the U.S., it's expected that more vaccinated people would be hospitalized with COVID simply because the vaccines aren't 100% protective against severe illness, Fauci said. Given the lack of national data on breakthrough illnesses among younger adults, it's unclear how many cases of severe disease there have been and whether boosters would provide a benefit. Quote, "I wouldn't be surprised that sooner or later you're going to see the data indicate that it's also going to be very important for younger people when they have boosters available to get the booster shot," Fauci said. Dr. Bob Wachter, the chair of the University of California, San Francisco, Department of Medicine, would like to expand boosters to adults over 18. Quote, "There's enough vaccine around," Wachter said. One of the biggest questions surrounding booster doses was a potential risk of inflammation of the heart muscle, or myocarditis, which has been associated with the mRNA vaccines, especially in young males. Israeli health officials report that no significant signals of myocarditis have emerged yet, Fauci said. Along with the push for boosters, giving first doses to the unvaccinated is critically important, experts say. Dr. Paul Sachs, a professor of medicine at Brigham and Women's Hospital and Harvard Medical School, said, quote, "It does appear that 2 doses just isn't sufficient. The vaccines don't work." Quote, "A practice that is laying the foundation of a vast amount of disease and of even more serious evils is the free use of poisonous drugs. When attacked by disease, many will not take the trouble to search out the cause of their illness. Their chief anxiety is to rid themselves of pain and inconvenience. So they resort to patent nostrums of whose real properties they know little, or they apply to a physician for some remedy to counteract the results of their misdoing, but with no thought of making a change in their unhealthful habits. If immediate benefit is not realized, another medicine is tried and then another. Thus the evil continues. Counsels on Health, page 89. This is Keep the Faith Ministry News. Thank you for watching.